All right, welcome. Today, we are going to become medical detectives. Seriously, we're going to learn how to read all those classic telltale signs the human body uses to tell us when something's wrong. Okay, let's jump right in.
I mean, really think about that. What if every little rash, every weird color, every strange tremor was actually a message, a clue pointing directly to a specific condition? Well, guess what? It is. And today, we're going to crack the code.
So to do this right, we're going to approach it just like a clinician would, systematically. We're starting at the head, and we're going to work our way all the way down, spotting all these critical clues that are often hiding in plain sight.
So, our investigation kicks off with the most visible part of the body. You know, the face can be like an open book, revealing some really deep systemic issues through very distinct changes in a person's appearance.
It's actually kind of amazing how some conditions can literally reshape a person's face. They create an appearance that's so distinct, it becomes this unforgettable sign for diagnosis. Let's look at a few of the most classic examples.
What's so wild about these is how specific they are. You see a rounded, full moon face? That screams Cushing syndrome. Swollen glands creating a chipmunk face? That's a clue for bulimia. A thickened, almost lion-like appearance they call leonine facies is a hallmark of leprosy. And that really disturbing fixed grin, rhissus sardonicus, that's a classic, unmistakable sign of tetanus.
But it's not just the overall shape of the face, right? If we zoom in even closer, features like the eyes and the mouth, well, they hold their own secrets. The trick is knowing exactly what you're looking for.
And this just shows you how one single feature can be a huge clue. Bulging eyes, or exophthalmos, are a telltale sign of Graves' disease. That dark bruising around the eyes, what they call raccoon eyes, points to a really serious basilar skull fracture. A bright red strawberry tongue is often seen in Kawasaki disease, while a smooth, beefy red tongue suggests something completely different, pernicious anemia.
Okay, now let's switch gears and focus on a sign that isn't about appearance but about movement. We're talking about one of the most recognizable signs in all of medicine, that unique tremor you see with Parkinson's disease. So, here's the crucial detail. It's not just any tremor. It's this very specific pill-rolling motion. It looks just like someone is rolling a tiny, invisible pill between their thumb and index finger. And the fact that it often happens when the hand is just resting makes it so distinctive for Parkinson's. All right, let's keep moving down the body. Our investigation now goes deeper, right into the body's core. And here, the clues can be things you hear through a stethoscope, things you feel with your hands, or even things you see in what the body produces. The chest gives us some powerful clues about the heart and lungs. An expanded, rounded barrel chest, for instance, suggests that air is getting trapped, which happens in conditions like COPD. That classic crushing chest pain is basically the body's fire alarm for angina or a heart attack. And a very specific machinery-like murmur that a doctor hears, that's the signature sound of a congenital heart defect called patent ductus arteriosus.
You know, when it comes to the abdomen, location is everything. For example, pain when a doctor presses under the right ribs, that's known as Murphy's sign, and it points right to an inflamed gallbladder. But tenderness in a totally different spot, McBurney's point, is the classic sign for appendicitis. In a baby, a doctor might feel for a small, hard, olive-like mass, which indicates pyloric stenosis. And finally, that bruising around the belly button, or Cullen's sign. That's a really worrying sign of pancreatitis.
Sometimes, the most direct evidence comes from, well, from what the body gets rid of. The infamous rice water stools are an absolute hallmark of cholera. Stool that looks like currant jelly is a critical sign of a type of bowel obstruction called intussusception, and coughing up rust-colored sputum is highly suggestive of pneumonia.
Okay, now let's shift our focus to the body's largest organ, the skin, and also the arms and legs. I mean, this outer canvas can display a huge range of signals, from rashes and sores to changes in shape and even sensation.
This is such a great example of why the little details matter so much. Both syphilis and chancroid can cause a sore, called a chancre. But here's the crucial difference. The chancre from syphilis is usually painless, while the one from chancroid is painful. One tiny detail, two totally different diagnoses. It's that important.
And here we go again, another key diagnostic distinction. Both of these conditions cause muscle weakness, but the pattern is the complete opposite. With Guillain-Barré syndrome, the weakness is typically ascending. It starts in the legs and literally moves up the body. But in myasthenia gravis, it's descending. It often starts with droopy eyelids and moves down.
The skin gives us just so many clues. You've got the classic butterfly rash that spreads across the cheeks, a hallmark of lupus. Then there's this strange bronze-like skin color that can signal Addison's disease. Faint, salmon-colored rose spots on the abdomen point toward typhoid fever. And finally, those tiny little red dots called petechia are a sign of bleeding, often seen in dengue fever.
Even our hands and our feet hold secrets. Take clubbing of the fingers, where the fingertips get all rounded and swollen. That's a classic sign of chronic low oxygen, like you'd see in the heart defect tetralogy of Fallot. Then there's Hohmann's sign, pain in the calf when you move the foot a certain way, which suggests a dangerous blood clot. And a single deep crease right across the palm of the hand is a physical marker often associated with Down syndrome. So, we've journeyed all the way from head to toe, gathering clues like a detective at a crime scene. But you know, collecting the clues is only half the battle. The real skill is knowing how to put them all together. And really, it all boils down to this. First, you have to observe the sign with a trained eye. You have to know what you're looking for. Then, you recognize the classic pattern that it represents. And finally, you connect that pattern to the underlying condition. It's a really powerful way of thinking that turns simple observation into an actual diagnosis.
Look, we have just scratched the surface of the body's secret language today. These signs are literally all around us, in medical dramas, in books, and just in life itself. So the real question is, now that you've been introduced to the code, what new details are you going to start to notice?